Hello and welcome. I'm excited for you to be taking on this journey of optimizing your health today. I'd like to take a few minutes to explain what to expect when going through a consultation with me. So my name is Dr. Romi Fung, and I'm currently a practicing naturopathic physician in Richmond, British Columbia. Did my pre-medical training in health sciences at Simon Fraser University, and shortly after that went on to the Canadian College of Naturopathic Medicine, where I studied naturopathic medicine. I am currently pursuing a master's degree in aging and health at Queen's University, and was also offered acceptance to the PhD in aging and health starting shortly. Along with my professional education, I'm also a Bowen therapist, as well as a functional medicine practitioner. I've received my certifications in acupuncture, as well as prescriptive authority from the College of Naturopathic Physicians of British Columbia. I'm also a Bredesen protocol practitioner from the Institute of Functional Medicine, where I work and focus my practice in optimizing the health and quality of life of those living with dementia. So, what to expect when you're seeing me? Well, prior to your initial consultation, I expect that it will be very helpful to fill the intake form that will be sent to you immediately after you register and make an appointment, either through the front desk or through my online application, JNAP. This will allow me to really understand where you're coming from and prepare, or allow me to prepare, what to expect. This also provides you an opportunity to understand what treatment may consist of, and for you to consent to the benefits and risks involved. You may also take a bit of time to organize any recent blood work in the past year or two and bring them to our initial consultation. This is where we have our first time together, our initial consultation, which usually lasts for about an hour. This is where I get to take your comprehensive history and really get to understand where you're coming from. It's almost like giving me the opportunity to put myself in your shoes and really understand how you're feeling. This is also an opportunity for me to see what your lifestyle behaviors are, any family history that we have to work around, and also looking over the blood work if you brought any. This is also an opportunity for me to conduct some physical exams and also some objective questionnaires if it's applicable. Especially in the case where I focus my practice on patients living with dementia, this will usually be 2 hours and will also include objective testing, objective questionnaires. At the end of this initial consultation, we talk about some initial recommendations, whether that be supplementation and/or lifestyle behaviors and management. This is where I may also consider and bringing up any testing that we may have to provide or that we may have to conduct. And some of this testing could involve blood work, pulse testing, which is to do with the cardiovascular health, food sensitivity testing, SIBO breath testing, which has to do with the digestive tract, hormonal testing, and/or stool testing. So this is where I'll bring up what testing may actually be indicated for us to really get a much more clearer picture about what's going on with your health. Once the results come back, that's when we consider looking into our second consultation, which is usually about 45 minutes. And this is when the laboratory testing results arrive. This is where we review those results, discuss them together, and really understand and connect the dots with what's on paper to really what's going on with symptoms. At the end of this consultation, this is where we propose a plan. This is where we pretty much finalize our plan to go for. And then from there, we will conduct subsequent consultations based on the chronicity of the condition. So this usually ranges about every 2 to 6 weeks for the first few sessions. And these are periodic check-ins that are about 30 minutes each. And this is where we evaluate what really is working and what isn't. It's almost like as if I take off my doctor hat and I put on my coaching hat. This is where I want to find out what's really working, not just in terms of the supplements or the treatment alone, but also if it's really fitting into your lifestyle and behaviors. This is where we tweak the plan and make changes as necessary. Along with subsequent consultations, this is where we might even consider utilizing some of the other naturopathic modalities. And what do I mean by naturopathic modalities? Well, one thing I use quite common and quite fondly is acupuncture. The insertion of very fine needles to really stimulate the flow of energy or qi. This is where I would suggest a patient to come see me, likely on a weekly basis for a few times to start, to really see and hold any changes that last. Another one will be Bowen therapy. And Bowen therapy is a very gentle manipulation of the fascia that really elicits the body to go into parasympathetic mode to allow healing. This is where I would suggest my patients to at least attend 3 to 5 visits on a weekly basis for effects to hold. We also talk a lot about clinical nutrition. And that doesn't just mean supplementation, even though that's also a big part of my practice, but to look into foods and diets that may fit your lifestyle. And if we do anything to do with food sensitivity testing and or SIBO breath tests, then this is where we also need to figure out which foods may in fact be beneficial and which foods we may have to take out for the time being. And so we discussed that in our consultations. Besides the use of supplements or vitamins and nutraceuticals, I also use a lot of botanicals, usually in the form of supplements such as capsules, but also in the form of tinctures. So this is also one thing that we might actually utilize and implement. So I hope that gives you a bit of an idea as to what to expect when actually seeing me in my practice. So just to reiterate that my first visit is usually 1 hour. And this is where we go over everything that we can. And in the second visit, usually about 3 to 4 weeks after the first visit, when we get all the lab work or laboratory testing results back, this is where we connect the dots and really finalize our plan moving forward. And then from there, we may be seeing each other on average every 2 to 6 weeks for 2 to 4 visits. And then we stagger that into the point where if it's being well maintained, that we just need to make sure that we keep it optimized and making sure that it still works for you over time. Unless if we go into acupuncture or Bowen therapy, then the sessions the frequency of sessions may be quite different, whether that be weekly or bi-weekly. For more information, you can always visit my website at www.drromifungnd.com. Like me on Facebook, follow me on Instagram, and subscribe to my YouTube channel for more information, as well as announcements about talks and webinars that I also conduct. If you have any questions and would like to reach to me individually, you're more than welcome to by emailing me at contact@drromifungnd.com. Thank you very much for your time. I look forward to working with you in your health.